Anesthesia monitoring, the silent guardian of every patient in surgery. When a patient is under anesthesia, they are vulnerable. The anesthesia team, especially the nurse, becomes their lifeline. This isn't just about putting someone to sleep. It's about managing their vital functions with precision. Like a pilot, nurses in the OR never rely on autopilot alone. They need to constantly check every instrument, every signal. Every beep and number on the monitor tells what's happening inside the patient. Under anesthesia, the body's natural defenses are down. Breathing, blood pressure, and temperature can all shift dangerously. Advanced monitors and strict protocols are the eyes and ears. Nurses need to interpret the data, spot problems early, and communicate with the team. Every patient is unique. Medication doses and responses vary, and the type of surgery adds complexity. Anesthesia monitoring is being proactive, and not just reactive. That is what saves lives. Let's break down the basics. The core four: oxygenation, ventilation, circulation, and temperature. These pillars are the foundation of safe anesthesia care. First, oxygenation, SpO2, aiming for above 95%. Next, ventilation. Capnography measures exhaled CO2, confirming both airway placement and ventilation. Circulation is monitored through heart rate and blood pressure, ECGs, and perfusion. Finally, temperature. Anesthesia and cold ORs can cause hypothermia. Warmth must be maintained. The core four is not about memorizing numbers. It's about understanding what matters most. Monitors give the data, but trends tell the real story. Heart rate. Bradycardia might mean too much anesthesia or low oxygen. Tachycardia could signal pain, light anesthesia, or blood loss. Blood pressure. Hypotension is common but can mean blood loss or a reaction. Hypertension might mean pain or anxiety. A drop in SpO2 below 90% is urgent. Airway and circulation need to be checked immediately. Capnography. A sudden drop to zero means a critical airway problem. Rising CO2 means hypoventilation. Falling CO2 could mean hyperventilation or low cardiac output. Stay alert to changes, not just single readings. Safety starts before the patient enters the OR with a thorough pre-anesthesia check. Review medical history, allergies, and previous anesthesia experiences. Check all equipment and monitors. In the OR, apply monitors before induction to get a baseline for heart rate, blood pressure, and SpO2. During surgery, document vital signs at least every 5 minutes. Watch the monitors, listen for alarms, and observe the patient. Look for physical signs like sweating, skin color changes, or unexpected movements. At the end, follow a careful wake-up protocol. Ensure strong breathing, clear airway, and stable vitals before extubation. The handoff to recovery is critical. Give a detailed report for seamless care. Not every alarm is a crisis. Sometimes it's just artifact from movement or a loose lead. Always check the patient first, not just the monitor. If O2 drops, look for cyanosis, check the airway, and confirm equipment placement. Suction the tube if needed. For sudden hypotension, assess for blood loss or shock. Communicate with the team, give fluids, and prepare for medications or transfusion. Malignant hyperthermia is rare but deadly. Watch for rising CO2, tachycardia, muscle rigidity, and hyperthermia. If you suspect it, stop triggering agents, call for help, and administer rescue medication immediately, following protocols. Systematic assessment, patient, equipment, then intervention, is key. Teamwork and communication are essential in emergencies. Every second counts in a true complication. Assessment is ongoing. Technology plus observation. Watch skin color, temperature, blood loss, and urine output for a full picture of stability. Anticipate needs. More fluids for blood loss, warming for long procedures. As anesthesia wears off, focus on return of reflexes and consciousness. Monitor for pain, nausea, and surgical site issues. In recovery, keep checking vitals and watch for hidden problems like bleeding or respiratory depression. Mastering anesthesia safety is a journey. Continuous learning and vigilance are key. Follow protocols every time. Stay disciplined, trust your training, and never cut corners.